Welcome back to the show. I've been having so much fun this week recording all of these episodes, talking about things that I'm passionate about, talking about things that clients reach out to me about and that you guys are always in my DMs about, and that's what should I put on my birth plan? This is how my labor went. How do I set boundaries with family? How will I know for sure that it's time to go to the hospital? All these are questions that I get, but also topics that I love to talk about. As you know, anything birth related is just totally my jam. And my job is to just get as much information out there possible so that you can make the best educated and informed decisions for yourself. I'd be lying to say that if I didn't have any biases, because we all do. That's how life shapes us, from personal experience, from things that I've seen. But what it boils down to is what you want. And what it boils down to even more is that even if things don't go the way that you want, that you felt validated and heard and informed, that birth didn't happen to you, but that you were a part of it. And it wasn't just all these people around you making decisions on your behalf. At the beginning of the week, I talked about why birth plans don't work. And so today I'm going to share 3 tips to having a bulletproof birth plan. And it's kind of I'm trying to find the word to describe it. Kind of, I guess, like a trick thing to having like a bulletproof birth plan, because the 3 things that are going to make your birth plan work don't really have anything to do with your birth plan. A few do, but it's a few things I talk about do, but it's mostly the decisions that you're making around your birth plan. And so let's dive into it. We're going to talk about education, building your team, and the prep work that you do. So the first thing does have to do with your birth plan. It's being educated on what's really on it. I'm not a fan of just downloading any old template that you find online and checking boxes, circling photos. I think that those can be confusing. I'm actually looking at one right now, and I'm going to kind of go over it in this episode because it just is like a list of things, and you check a couple of boxes of things that you want, but there's all these words on there of things that maybe you don't want. So how I like to construct my birth plans is just your information, your partner's information, maybe your doula, your provider, all that at the top, and then you just have bullet point, like in case of induction, bold, in case of induction, underneath it, your bullet points of what you want. For labor, your bullet points of what you want. For baby, bullet points of what you want. Postpartum, bullet points of what you want. In case of cesarean, bullet points you want. And it's all on one page. I know it sounds like a lot of information. I should have printed mine out to bring with me to show you guys on YouTube. But it's all on one page. So it's not pages of things that people are flipping through. It's not confusing. It's all right there. It's bullet points, and it's super straightforward and simple. So I'm going to talk about this one. Some of them will be like how to create your atmosphere. And this one has, 9 things underneath it. And you can check what you want for your atmosphere. Instead of doing that, you can just put on your birth plan, dim lights, calm music. But looking at this, it kind of seems confusing because it's like atmosphere. Oh yeah, dim lights sound really great. Ooh, calming music. Yes, that sounds nice. Minimal staff. Yes, that sounds nice. Ooh, an oil diffuser. But it's also not telling you that you have to bring all that stuff on your own. You can bring little tea light candles. I think those are a great option to set up around the room, or just like any sort of electric candle or battery operated candle. Set up around the room, turn off the lights, turn on your candles, bring your own Bluetooth speaker, put on your calming playlist. For me, music is huge, and I built my playlist for months before having Jovi. And then for each birth, I've added onto it, and I can share the link to that in the show notes too. I have a few different playlists, but I brought my own Bluetooth speaker from home, and to make sure that I had that, like, you can't just assume the hospital is going to provide these things for you. Birthing centers might have some. I know that our birthing center had an oil diffuser, a Bluetooth speaker, dim lighting. Doulas also usually carry these things as well. I know in my doula bag, I have a Bluetooth speaker, candle light, battery operated candles, and an oil diffuser and some oils. So those are all things that you have to bring yourself. So it can be confusing just looking at a template and being like, oh yeah, I want all these things. And then you show up to your appointment and they're like, okay, yeah, you can have that. But then you get to the hospital and you're like, well, where are these things? It's like, you have to provide that yourself. Like the cold, you can check labor preferences, cold and hot therapy. But what does that mean? Like, and are the staff like looking at, oh, she's getting into the throes of labor right now. Let's see what's on her labor preferences. Oh, she wants cold and hot therapy. Let's give her these options. It's just kind of like assessing the situation and seeing like what you need in the moment versus maybe you really had a preference on something. So that's why I don't like these lists, because I think these lists can be good to show you what your options could be, but it can be confusing when you have this like multi-page template with pictures and photos and all this stuff on there that it's like I have to decipher these hieroglyphics and there's a list of things and you check marked one. So it's like, why is this giant column of stuff on your birth plan and you checked one thing on there that you want? Just put the one thing that you want on your birth plan. But it can bring up good conversation. The reason why education is important for your birth plan is because there's things that don't go together. So if I'm looking at this and it's saying that you want an epidural, but you don't want an IV, those things can't coexist in a birth plan. So you're checking, yeah, I don't want an IV, check. Ooh, but I do want to have an epidural, check. And I definitely want intermittent monitoring because I heard that continual monitoring leads to higher C-sections, check. Well, that's true. Continual fetal monitoring does lead to higher C-sections. But if you're going to have an epidural, they need to be able to check in on your baby continually because now you are putting drugs into your body and you need to see how the baby's reacting. You can't just, choose one without the other because you need to make sure that you are medicating yourself safely and your baby. And you also have to have an IV. Even if you're choosing to eat and drink on your own, you have to have a bag of IV fluids before you receive an epidural. So that's why the education is important, because I can print off this list, check a couple of things, but it doesn't make sense. So if you're taking this into your provider and they're like, this person obviously knows nothing about birth, which is fine because we haven't been told anything, but it's your responsibility to start educating yourself on each of these options and what actually makes sense for you. Like you wouldn't check, yes, I want an epidural and I want, to be able to walk around with my contractions. It's like, well, obviously you can walk around with your contractions before you get the epidural, but afterwards you can't, which that should be pretty obvious, right? But there is still options. So again, it's kind of a double whammy. You can pull up a birth plan, see what's on there so that you're like, okay, this is showing me what some of my options are, but what actually makes sense, what goes together. So that's why I also love doulas, because they're going to help you formulate that perfectly. And also the course that I'm coming out with and my one-on-one consults, I do that as well. So it's good because you see your options, but again, you have to educate on your own. But this is also giving you like, hey, these are different birthing positions. I want to birth on hands and knees, and I want an epidural. Those two things can coexist, despite what you may think. You're like, wait, I'm going to be numb. I'm not going to be able to move. I have been at so many births that we're getting on hands and knees with an epidural to get baby to get into a better position, to try to help labor keep moving, which is usually because the baby's not in a great position, to just have different comfort for mom. There's so many benefits to being on hands and knees. You can birth in different positions with an epidural. And so that's going to be something that you take to your provider and talk about. So that's going to bring me to my next point. So your first tip is being educated about the birth plan and how to use it as a tool. Number 2 is choosing your right team. So once you finally figure out what you want on your birth plan, how to use it right, and what's going on, you're going to bring that to your provider. A lot of times, I had mentioned on Monday, people aren't taking it in until their 36-week appointment. And I think that is too late. Obviously, there's never too late. So if you're listening to this, you're 38 weeks, you're like, crap, I need to get on this, do it. But if you're planning on potentially switching providers because they're not in alignment with your birth plan, that's something that you need to do now. So I would get your birth plan together, you take it to your provider and figure out, is this the right team for me? If you're talking to them about getting an epidural and also birthing on hands and knees, and they're like, oh no, absolutely not, maybe that's not the person you want to be birthing with. Or you take your birth plan to them and it says, in case of induction, and you're saying that you don't want Pitocin on there and you're having other options, and they're like, oh no, absolutely not. Or if you're talking to them about if your water breaks, staying at home a while, and they're like, no, absolutely not. Or you're like, asking the questions of, well, why would we induce? And if they're like, oh, if you go past your due date. Well, evidence doesn't support that. So how do you feel about that? Where's your informed consent instead of just hearing a hard no? Like, they need to be able to present the evidence of, here's the risks of going past your due dates. This is the risks of things that could increase, risks to you, risks to the baby. What's the evidence behind that? Because I have heard a whole lot of crap that is not evidence. If somebody tells you, well, your placenta starts aging and blah, 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 and the baby could get too big, that doesn't make sense. If your baby's getting too big and growing, that's because the placenta is still nourishing them. So how is it aging? That the evidence on an aging placenta has been debunked so many times, and I'm so tired of hearing people say that because it's not true. And also, I mean, there is kind of like a limit of a date of like when maybe you don't want to go past because certain risks go up. So that's information that you deserve to know and to make that decision for yourself. However, these providers telling you that you have to be induced, but not giving you the risks of induction or the risk of Pitocin. Pitocin leads to fetal distress. It leads to a higher cesarean rate. Are they telling you that? So it's important to use this as a tool to take in. And also talking about a C-section, like maybe that's not your plan, but let's say you end up having to need a C-section, there's options for that. So checking those things off on your birth plan and talking to them about a gentle C-section, like what does that look like? Can I still do immediate skin to skin in the OR? Can I not have my arms strapped down? Can I have my playlist playing? All of these are options. There's even places that have a clear drape up so you can see the baby. You're not going to see them like performing the surgery. But I've also seen where women are able to pull their own babies out. Like the doctor starts to pull them out and then you can grab the baby and bring them onto your chest. There's very few places doing that right now, but hopefully that'll be the norm soon. And if that's an option that you want, that you could do it. So talking to them about you doing skin to skin right away, and then your partner doing skin to skin, and just your different options with that. Because when that situation arises, that's not in your mind, right? Like, let's say it ends up being a cesarean. You're not like, oh wait, can I bring my music in there? Can I do this? Can I whatever? But it's already on your list. And so you've already gone over it. So then your partner also is educated on it and can grab those things for you, help get everything set up, or your doula can help. And then again, you're not feeling like everything's just so chaotic and out of your control around you. So building the right team, taking this to your provider and saying, this is what I want, this is blah, 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 and having real honest conversations with them, and seeing how they react. Sometimes people are like, oh yeah, no problem, we can do that. But that's again why I like open-ended questions. So let's just use birthing on your hands and knees, right? Saying, I'd like to birth on my hands and knees. And they'll be like, okay, yeah, I mean, if it works out, we can try that. Okay, that's not really like a straight answer. So maybe asking, so how do you feel about birthing in different positions? and seeing what your provider says, because that's actually a question that I asked an OB before Vito and I got married. I had gone to an OB here. I didn't know anyone in the area because I had just moved here like a year before. And I asked him, I'm like, how do you feel about women birthing in different positions? And he said, oh no, you have to birth on your back. And so I immediately knew that's obviously not where I was going to be going to receive care, because I know what I want, and I know that what the research and evidence shows about that not being a great position. It's closing up your lower back, your sacrum, which needs to be able to open to help the baby come down. It's not working with gravity, and your knees out actually narrows your pelvis. They've shown now, like when you put your knees in, it's actually opening your pelvis. So let's say these are your pelvis muscles. If you're watching the video and you put your knees out, those muscles are getting tighter, or those bones are moving in together, versus if you put your knees in, you're opening up. So opening up your knees together, feet out is a great position for allowing the baby to come down into the birth canal. And it's been really, really helpful for a lot of births that I've gone to, versus like having your knees way out by your armpits and pushing on your back. So I knew just from that one question that that wasn't where I would be receiving care, because he and I probably weren't going to be in alignment on a lot of things. So it's important for you to get informed and be educated. So that is the third point, is building that team. Also, your team includes your partner. It includes whoever you want in that room with you. So getting your partner on board, informing them over the birth plan, letting them in on how you're envisioning things. What are your fears? Let's say that you're like, I really, really, really just don't want to get Pitocin in labor. He might not know what that is, right? You're like, okay, it's synthetic oxytocin that makes your uterus contract. But if he doesn't necessarily have to know everything, but like for your partner to get on board, they need an insight into your mind. So knowing what your fears are, if you're like, okay, I really don't want to get Pitocin. So then when they bring that up in labor, your partner can be like, you know what, can we just talk for a little bit? And that gives you space to breathe and think. And there's an acronym that I use all the time, and I tell it to everybody to use all the time, and it's called BRAIN. So anytime any situation comes up in labor, ask, what are the benefits? What are the risks? What are my alternatives? What's my intuition saying? And what happens if we do nothing? And 9 out of 10 times, doing nothing is an option. If you're like, you know what? If they're like, oh, we need to start you on Pitocin. Like even this birth I was at this last year, like we need to start Pitocin. And she's like, actually, I don't want Pitocin. And they're like, okay, we'll check back in 5 hours. I was like, wait, what? So I don't need it, right? Like if you really, really needed it, they might be pushing it harder, but there's not a ton of situations that really, really need Pitocin. So getting them informed on what your wishes are, getting them on the same team, and then also just talking about the power of intuition and the power of like our authoritative medical biases, right? So we think just because this doctor comes in and is like, oh, you need to be put on Pitocin, we're like, oh, okay, well, you're the doctor. Let's just do what they say. But you're a grown adult. You can read research. You do have options. You're not a, line in an assembly line where everything is the same. There's individualized care. And Pitocin is one of the most overused drugs in the United States. And there's actually a black label warning on it to not use for induction. So it's not always a great option, which could be like a whole other podcast, which you're going to hear me say a lot, like, oh, there's a whole other podcast on this topic, because there's just so much information and research out there, right? And I'm so excited to dive into all of that with you guys this year. But getting informed, getting your partner informed, and then if you have a doula, making sure that they're on the same page. Not every single doula is going to vibe with you. Not every single one is going to do exactly like what you want. Like I've heard, I'd mentioned in yesterday's podcast, like just like not great stories of doulas, which like makes me sad when I hear those. And I'm sure the same goes for like OBs when they hear OBs who just like suck, and midwives who suck, and people who just like aren't great supporting their clients, their patients. it sucks, right? Like when you hear that. And so getting a doula who is on the same page with you and asking them the hard questions too. If you're expecting your doula to advocate for you at your birth, asking that in the interview, like, how do you feel about advocating? What does that look like? What if they come in and offer me this thing that I don't really want, but I'm too deep in labor to really talk about it? Like, what does that look like? So making sure that they're on the same page, and that they're going to be able to support you in the best way possible. And like I said, anybody else who's going to be in there. So this even goes back to boundary setting. Let's say you're going to have your mom in there, talking to her what's going to go down. Because let's say she's not used to unmedicated labor. Mine looked very, very different from, like Vito mentioned yesterday, his mom was at his sister's, at his sister-in-law's. And, you know, you're struggling through it. You get the epidural, and then they're kind of like chilling, waiting for it's push time, right? Mine was like a little bit different with the first one. I ended up getting an epidural, but like for the first 17 hours, I was just like throwing up all over the room, in so much pain in every single position, all over, walking around naked. Like, is that something that you're okay with this person being in there for with you? And are they okay? Are they going to be bringing in this nervous energy and being like, you know what, you should just get an epidural? Because I've been at those births too. I've been at a birth where the mom told the daughter, I don't know, I just think you need to get a C-section. And she didn't want one, and she was doing fine, but she was fear-mongered into it from family and from her provider. And then a family member was like, I told you you'd probably need one. And it was like a generational trauma, crazy birth that I was at. And you might not want that energy in there. So those are conversations to have with your team beforehand. And then the third tip is preparation. So again, going back to the birth plan, if you're like, I don't want an epidural, I want intermittent monitoring, to walk around, my water to break on its own, to catch my own baby, to birth on all fours, to use a birth ball, you're gonna need to do some education. Not saying that you're not gonna know how to do it, or some prep work. Not saying your body's not gonna naturally know how to do it, because it does. But if you're birthing in a setting such as a hospital, you are gonna have people coming in making different suggestions. So you have to be prepared mentally and emotionally to birth your way and on your terms. And so that takes some prep work. That does look like taking a childbirth education course, taking my birth plan prep course. It looks like doing affirmations, guided meditations, getting your team really on board to support you. It looks like knowing your rights in birth and not being afraid to advocate for them. It's kind of like everything we talked about this week all in one, like setting boundaries, knowing when to go to the hospital, because if you want that kind of birth, you're going to want to labor at home a lot longer than if you want an epidural. And even if you want an epidural, that takes prep work too. Like 15% of epidurals don't work. So how are you going to be prepared elsewise? What are your other options of pain relief? I recently heard a story of a birth where she asked for the epidural and the nurse said, oh no, honey, we can't give that to you yet. Yes, you can. Or like I said yesterday, if they're like, oh, you're 9 centimeters, like you're 10 centimeters, we can't give you the epidural. Yes, you can. So those are questions to ask your provider, to be educated on, and to do prep work to know how to advocate for yourself. Because it sucks, right? When you're like, I can't get an epidural now. I didn't know that. Like, I didn't plan on birthing this baby unmedicated. I really don't want to. Now what? What does that look like? So being educated on all your options, knowing the birth plan, doing the prep work with knowing your rights, being mentally prepared, emotionally, even being prepared. Stuff flies out the window in birth sometimes, and you can change your mind. That's fine. And that's not the purpose of a birth plan. So if people are like, oh, I just threw my birth plan out the window, that's okay, but that's not the point of the birth plan. You make this plan of the options that you want, but then it's like, okay, you wanted the epidural. That didn't work. Now what? or you didn't plan on getting one, you got one, but now what? Do you still have other options? Is everything out the window? Can you still birth on all fours? Can you turn to your side? Are you still getting other things on your birth list? What about when the baby comes out? What are the newborn procedures? Delayed cord clamping. That's the other thing that I heard at a birth, saying that, if the cord pulses past a minute, the blood goes back to the placenta and comes back and can actually give an infection to the baby and die. There is zero evidence to support that. Evidence supports letting the cord pulse until it is done, until it's done pulsing. And ACOG suggests like 3 minutes or something like that, for at least. It doesn't say until 3 minutes. It's 2 or 3. It says at least 2 or 3 minutes. I actually got a lotus birth, which we'll share in the birth story. So this last time my placenta, he stayed attached until I birthed my placenta. So he was attached the whole time. But, so like knowing all of these options is so, so important and vital. And people don't realize that because they're like, I'm just gonna go to the hospital. I'm gonna get an epidural and, that's it. That's my plan. Again, what if your epidural doesn't work? What if you have a precipitous labor, which is like a crazy, super fast labor, and it doesn't happen? What if you're having side effects to the epidural? What if, what are your other options? Like, those are so, so important to know. You guys know me by now that I just really want you to feel informed going into this so that you feel supported, and educated, and that you are a huge part of your birth, that you're the one calling the shots and it's just not happening to you. All right, that's it for today's episode. For the giveaway for today, it's going to be taking my birth plan birth course for free. If you are going to be giving birth past March, it'll be out by March or in March. You can not sign up. You can enter this giveaway. It's going to be a $250 value. And it's also a one-on-one birth plan consult with me, which can be done at any time. So in order to enter this drawing, you have to leave a review of the podcast, screenshot it, and either DM me on Instagram, email me at elizabethjoy.co, or email me. You can DM me on Facebook. I had a couple people on Facebook, in the Facebook group, or on Instagram, and you will be entered into the drawing for that. And I'm really, really excited and looking forward to working with some of you one-on-one. I know some people have already reached out about it, and I am just really pumped for everything this year is bringing, with the birth plan birth course, and just doing these educational episodes along with incredible guests. So next week we're having a guest on talking about the new year. Caitlin's going to be bringing us through like how to have time management and how to organize, and how that plays into motherhood, because we are overwhelmed. Our brain is in a million different directions. Mom brain is real. So how can we lighten our load? Which is something that I recorded this like months ago. I'm excited to listen back to, because I'm like, wait, I need this now. Because it's always just like a great reminder. And sometimes you start getting into a new routine and then you fall out of it, like over the holidays, or having another kid, or just being crazy at work and letting a few things go. And then you're like, why is my life so chaotic? Why can't I get it together? So we are going to give you some tips for doing that and just learning to thrive in this season of life. Because I think that is possible. Yes, there are days where I feel like I am surviving, but I really want to thrive. And I know that it's possible. So I'm really excited for next week's episode. All right, guys, have a great weekend. And also, just a reminder quick, if you were listening to this in the future, the entry for the drawing ends January 31st, 2024. All right, we will talk to you next week. Bye.